Hey guys, it's Dr. Roberts here, and I wanted to talk to you today about a very important topic and something that I see on a daily basis. And before we get started with that, I want to show you this right here. So what is that? So that is a diagnosis code, M96.1. So let me explain this a little bit. Anytime you go to a medical provider, healthcare provider, whether you've got neck pain, back pain, cold, pneumonia, whatever the case may be, once you're diagnosed with something, there is a very specific code linked to that diagnosis, so it's across the board. Any physician that sees that can know exactly what you've been diagnosed with. Well, this code, M96.1, is for failed back surgery syndrome. You may ask yourself, well, why is there a code for failed back surgery syndrome? And the quick and easy answer is there's a code for it because it happens so often. Now, with my experience, what I've seen in the office, patients that undergo cervical surgeries, whether that's fusions, discectomies, whatever they happen to have in the neck, tend to have more success than in the low back. So in the low back, from what I've seen, you might as well flip a coin as to whether you're going to get results or not from low back surgery. And unfortunately, even the patients that do get good results from their low back surgery, you're looking at maybe 2 years before those symptoms start to show up again, and you're looking at more and more surgery, more and more procedures, more and more injections, whatever. Just you can go down the rabbit hole of those options. So what I'm trying to introduce to you is a different option than going down the surgical route. Now look, if you need surgery, then by all means, sometimes the body, sometimes the disc, sometimes the tissue has deteriorated to the point where surgery is your only answer. And I'm not saying like don't get surgery if you truly need it, but why wouldn't you want to prolong that or push that option away or never have to go down that road if you didn't have to? That's why I always encourage the most conservative treatment option first. And what we have to offer is, I'm sitting on the table right now, decompression. And we can do decompression for both the neck and the low back. And what the decompression does is it allows the disc to heal. And that disc is usually what's causing your symptoms, because that disc material is bulging or herniating out, hitting the nerve, causing you extreme pain in the neck, low back, or even worse, symptoms that go down the arms or down the legs. And that can be numbness, tingling, burning, shooting. It can be a number of things that nerve is causing symptoms down the arms or down the legs. So, moral of the story is, the whole reason behind this video is, if you've been told that you have to have surgery, that your only option is surgery, let's get a second opinion. Let's see if we can avoid that expensive option that you can't go back. Once you go under the knife, once you get cut on, you can't go back. And what I've seen is, even patients that have successful fusions, think of it like this. If you've got two vertebrae and they fuse it together, that fusion is like a brick wall. Okay, it's not moving, but you still have to live life. You still have to bend and twist and lift and pick up and all that stuff. So what happens is, if that joint isn't moving, the joints above and the joints below have to work overtime. They have to do more of the load, and what happens is, over the years, those joints above and joints below start to wear down quicker. So then you're looking at surgery at those levels. So anyway, guys, the moral of the story is, let's try to avoid surgery if we can at all costs. If you have any questions about decompression, give us a call at 615-645-9994. I'd be happy to do a free consultation with you to see if you can be one that avoids the unfortunate diagnosis code of M96.1, failed back surgery syndrome.